PhD in psychology. I'm currently working in Romania, doing what I can do my best, using neuro-linguistic programming in psychotherapy. I'm a graduate member within the British Psychological Society and associate member within the American Psychological Association. So my presentation today is a matter of fact of a literature review. It's about the effectiveness of neuro-linguistic programming methods and techniques in the process of facilitating change and symptom relief in trauma and addiction. The content is quite simple. It's about the abstract background, research questions and hypotheses, methods, results, discussion, and resources. So neurolinguistic programming in the field of psychology, and not only in the field of psychotherapy as well, is a topic of much debate nowadays. The purpose of this present study was to examine how neurolinguistic programming can be effective in facilitating change and symptom relief in trauma and addiction. It is quite a very well-known fact that trauma is stored in the body as implicit memory, one of the two main types of memory. The key point to remember is that as long as trauma is stored in the body, it can be easily triggered by different events and external stimuli completely detached from rational thinking. When people are triggered, what happens is that fragments of memory are returning along with very strong and uncontrollable feelings like intense fear or any other sensations which have been stored during the original trauma and now being triggered again. They are experienced in the present moment as being real. Through its methods and techniques, like meta-model, reframing, association, dissociation, and others, neuro-linguistic programming offers a very lucrative and on-target support to individuals to challenge their implicit memory of trauma and its limitations. It's a way of, although psychologically speaking, it's not possible, but it is a way of turning the implicit memory into explicit memory, moving from trauma stored in the body at an unconscious level to trauma stored in the brain at a conscious level. Explicit memory being, therefore, under the control of the conscious mind, the place where positive changes can be settled consciously and on purpose. Addiction is defined as the compulsion to continually engage in an activity or behavior, no matter the negative impact on the person's ability to remain functional and control with the self, in the home as well in this community or society. Neuro-linguistic programming has the answers to the why a transition from recreational drug or alcohol use, for example, to compulsive drug taking, and to the how to move from compulsiveness to step-by-step awareness, acknowledgement, and control, leading to positive changes. Neuro-linguistic programming is essentially concerned with how we filter, how we perceive, how we acknowledge and give meaning to the word, and the way that different conscious or unconscious bias influences our outcomes. The main theory behind neurolinguistic programming is that the moment we bring our conscious awareness to cognitive and sensorial filters and biases, we can begin to make choices in a conscious way that result in positive changes. Critical appraisal of evidence-based research in the particular area to indicate the benefits of neurolinguistic programming in treating trauma and PTSD is highly needed, along with increasing randomized control clinical trials. As soon as its effectiveness is demonstrated, the necessity for neurolinguistic programming to be accepted worldwide as a top form of psychotherapy becomes an irrefutable necessity. As a part of the background of this literature review, the key points to be remembered is that although the post-traumatic stress disorder is considered to be an onset persistence that varies significantly by trauma type and most of methods so far. Most studies are incapable of nominating or quantifying how much of a post-traumatic stress disorder is influenced by trauma type and how much is influenced by psychological equipment of the individual. Although conceptualizing how trauma can impact the different types of memory can be challenging, addressing explicit memory and accessing it at the conscious level, where acknowledgement and learning are possible, is the biggest challenge. For example, in 2017, a study was conducted in Narayana Medical College and Hospital in India on nurses who experienced physical and emotional distress while caring for patients who were suffering, traumatized, seriously ill, and or dying. These nurses considered that they were traumatized by what they were experiencing in the hospital while working with this kind of patients. And they used in this study neurolinguistic programming to provide a practical way in which one could change the way of thinking, their view on past events and approach of life. Due to NLP techniques such as meta model, reframing, and visual kinesthetic disassociation, they were able to influence their brain to develop a new adaptive behavior by means of language, communication, and by recoding the response of stimuli by brain for obviously new and enhanced behavior. It's very important to have a closer look and a very simplified way of perceiving memory, explicit and implicit memory, and the way the traumatic events impact our different types of memory. As you see, explicit memory, of course, is composed of semantic and episodic memory, while implicit memory is about emotional and procedural memory, both happening in the unconscious level. So if the implicit memory is affected by traumatic events, like, after a trauma, a person may get triggered and experience painful emotions, often without context, without acknowledging, without being aware of. Procedure memory can be affected as well. Trauma can change patterns of procedural memory. For example, a person might tense up and unconsciously alter their posture, which could lead to pain or even numbness. Explicit memory, on the other side, is affected by trauma in different ways. Trauma can shut down episodic memory and fragment the sequence of events, but this happening at a conscious level leaves the gates open to different kind of therapies so as to enter and produce change. While neurolinguistic programming has very pragmatic and on-target and on-purpose techniques like meta model, like reframing, like visual and kinesthetic dissociation, they can enter even in this kind of episodic memory and help to recompose the sequence of events so as to make sense recover what they lost in the traumatic, or what it seems to be lost in the traumatic event. When it comes about semantic memory, trauma can prevent information like words, like images, like sounds from different parts of the brain from combining to make a semantic memory. Here again is the field of neuro-linguistic programming. Through its techniques, that this can produce a huge difference for clients coming up after traumatic events. If implicit memories of a traumatic event are stored in the survival part of the brain, responsible for flight, fight, freeze, like amygdala, and influence our behavior and emotional responses, while explicit memories of the same traumatic event are stored in those parts of the brain responsible for thinking, for taking decisions, and they are conscious and intentional memories that we can recall with effort. How can we secure implicit memory? Use the information provided by that while working completely with the details coming from explicit memory, avoiding suppressing or repressing feelings connected to the traumatic event. Another question is, how can we make a better and better usage of conscious and on-purpose dissociation technique coming from NLP to secure the individual from implicit memories occurring after a traumatic event is experienced and work entirely at a conscious level with explicit memory details? And finally, one of the last questions is, what are the extended benefits of meta model along with reframing in treating patients experiencing addiction or recovering after traumatic events? I will stop for a bit at methods used for this systematic literature research. Here you see numbers, not very important. And finally, studies included in the synthesis, like 12 studies included, for other cited references, to total studies, it's like 8. Results. NLP is considered among many countries around the world as a therapeutic technique used to detect mind's distortions, mind's limitations and generalizations, deletions, and reprogram unconscious patterns of thoughts and behavior in order to alter psychological responses. The co-creators of NLP, like Dr. Richard Bandler and John Grinder, have proved that there is a connection between the neurological process, language, and behavioral patterns learned through experience. And once the mind was capable to program itself for destruction, it means it is capable as well to program itself for construction and success. Reframing in trauma and addiction. Reframing, as I said, is an NLP technique widely used in so many areas, starting with psychotherapy up to education and academic area, where people want to get better and better results in what they do. Content reframing is, a matter of fact, the process of using visualization exercises to reframe how we see a situation in which we felt victimized or powerless. Instead of letting our perspective of a situation flood us with feelings of hopelessness and despair, we begin to look at it with a positive outlook, a very grounded positive outlook based on our internal resources. The entire process is happening at a conscious level, and the key to success is to saturate the brain with the new image created up to the level of deep submodalities. When it comes about meta model in trauma and addiction, it's very important to talk about the key components of the NLP meta model. And these key components of neuro-linguistic programming are distortion. And the aim of distortion is to identify and challenge statements that seem to alter reality. For example, if someone coming after traumatic events says, "Parties make me feel anxious," an NLP therapist might ask, "How does a party make you anxious?" So as to uncover the process behind this feeling. Or what from a dead party might make you feel anxious, you know. Generalization is another component, and this is about addressing statements that apply specific experiences broadly. Example, you always treat me bad, and can be challenged by asking, can you think of a time when I treated you good, to break down the universal quantifier? Or can you name what are the characteristics of someone treating you good? And you know that person is going to list all the characteristics of a person treating you herself or himself good. And then another question might be, did I ever did something from, you know, that list so as to be good to you? Deletion is one very important key component of neuro-linguistic programming meta model. Deletion is about filling in missing information in communication. For example, I always feel bad when the door is locked, can be specified by asking what specifically makes you feel bad. Okay? Why the door locked makes you feel bad. And this could be the gate to new discoveries in the patient's life who experienced a traumatic event. A neurolinguistic programming meta model is a comprehensive framework consisting of specific questions designed to uncover and clarify the details of a person's language. Meta communication describes the subtlety of language, underlying requested or worded information, precious details like those hidden in trauma and addiction that as soon as they are recovered due to meta model of neurolinguistic programming, the key to therapeutic intervention is assured. As you see in this drawing, NLP model has meta model has extremely powerful questions. Through deletion, we recover information. Through distortion, we correct information. And through generalization, we challenge the limitations, the limited beliefs, or other preconceptions that the patient might have. Discussion. Well, neurolinguistic programming techniques such as visual kinesthetic disassociation, meta model, and reframing contributed to better emotional regulation and self-awareness, enable people to handle stress and anxiety after traumatic events more effectively. Critical thinking was proved by so many studies in other areas, mind health and education, due to meta model of NLP. It's becoming increasingly difficult to ignore linguistic programming. The most crucial role of NLP is to help humans better communicate with themselves and control negative emotions and anxiety. Neurolinguistic programming is considered an assistive technology that can help people after experiencing traumatic events or dealing with addiction to develop outstanding skills such as critical thinking, emotional intelligence, self-efficacy, and empathy. These skills are necessary for understanding what they experience and challenge all the limitations, preconceptions, and other limitative beliefs, along with the meaning they gave to different events. The purpose is to gain self-conscious knowledge so as to lead to self-conscious control of their mind. Thank you.
Thank you. Does anyone have any questions, suggestions, or comments?